Uh, Next year we'll have a lot of fun, not this one. But on this one, you should be able to identify the blood vessels, veins and arteries, also the walls, the tunics, what they are, what they're called, and what they're composed of. And the other slides will be on the trachea, the wall of the trachea, and sections through the lung. And not that much, but there are a few pertinent features that you need to be able to identify. So don't just blow it off, say, well, I'm just going to throw those points away. Those points may come in handy later on. Okay? So this exam will be a lot on models. There'll be also pigs on this, I assure you, and perhaps a heart as well, the sheep heart. So make sure you can identify these. If you haven't looked at the pig, you got one of those dissection guides, I suggest you study that. If you want to look at the pigs today, that's fine too. Okay, but there will be some pigs. And the pigs I'm using, not my pig, it's going to be your pigs. So they're not well dissected, oh well, okay? What you've done. I will pick out blood vessels. And the ones that are basically blue, or the blue typex, those are veins, and the ones with the pink typex are arteries. Okay? All right, we're going to start here by looking at this section through some blood vessels. And as I said, from now on, I'm going to expect you to identify blood vessels in tissue sections. This is very important when you get into the next units. You look at the digestive system because you're going to have a lot of ducts. Okay? D-U-C-T-S, not D-U-C-K-S. All right? These are tubes, and you've got to be able to differentiate between blood vessels and the ducts on these various glands. You're going to see them in salivary glands, you're going to see them in the liver, you're going to see them in the pancreas. So you've got to be able to pick them out. All blood vessels are lined with what kind of tissue? Simple squamous epithelium. That's part of the tunica intima. All right? We can tell simple squamous because it's a single layer of flattened nuclei. That applies to all lower blood vessels. Capillaries right to the largest veins and arteries. As we're going to see, these ducts in the digestive system, salivary glands, liver, pancreas, and so on, usually the small ducts are simple cuboidal epithelium. What does cuboidal look like?
Cubes.
What's the nucleus look like?
Round. Almost the
They're
same.
round, okay? And in columnar cells, it's an oval nucleus. So you look at the shape of the nucleus, it's normally well stained because you can't see the cell boundaries. Okay. So we're going to start here, and first off, you can see a vein and artery. What is this?
Artery.
That is an artery. You can tell because they tend to be smaller than the corresponding vein. They have a smaller lumen overall, that's where the blood flows, and a thicker wall because they have to handle blood of higher blood pressure. And generally speaking, they contain blood of higher oxygen content than the corresponding veins. There are a couple exceptions. What are they? Where actually the vein or veins are carrying blood of higher oxygen content than the corresponding artery. The pulmonary circuit is one. Remember, pulmonary arteries have lower oxygen content because they're carrying blood from the right side of the heart, lower oxygen content out to the lungs. The blood comes back via the pulmonary veins, high oxygen content to the left side of the heart. So that's one example, the pulmonary circuit. What's the other one?
The fetus.
The umbilical circuit, where the umbilical arteries are carrying blood from the fetus to the umbilical, via the umbilical cord to the placenta. That comes back highly oxygenated by the umbilical vein back to the fetus. Okay? So if you're asked, exceptions, pulmonary circuit, pulmonary arteries and veins, and the umbilical. Okay? But otherwise, generally speaking, the arteries carry blood of higher oxygen content than the corresponding veins. All right, the three layers, which we've been over, you should know by now, they're basically the same in both veins and arteries. They just tend to be thicker in arteries than in veins. All right, so the lining again, shown here in kind of a red-orange color. Now, normally this would be nice and smooth, but when these tissues are fixed, it causes the muscle to contract, and that's what throws it into folds. So what do we call this layer? That's a tunica intima or tunica interna. And what does it consist of? Simple squamous epithelium, a little bit of loose connective tissue. It's a very thin layer. Collectively, this is referred to as what kind of cells? Endothelial cells, yes. Or the endothelium, collectively. Which, remember, is continuous with the lining of the heart. What's the line of the heart? Endocardium. The endocardium. So the endocardium lining the heart chambers, covering heart valves, is continuous with the endothelium of the blood vessels. And same stuff, simple squamous, a little bit of loose connective tissue. Okay, this middle layer here is what? It's a tunica media, and what does it consist of? Smooth muscle. Make sure you say smooth muscle, and what else? Elastic fiber. So it's the contraction of smooth muscle brings about vasoconstriction, narrows the cavity. And as we saw, what does that do? It brings the blood pressure up. Okay, because you have more peripheral resistance as a result. Okay, when this smooth muscle relaxes, that's vasodilation. It drops the blood pressure, and of course, it increases blood flow. And remember, vasoconstriction happens too as part of hemostasis. That's the vascular spasm we talked about, which reduces blood flow. And this outer layer? Tunica externa, tunica adventitia. What kind of tissue are we dealing with? It's connective tissue. So it's collagen fibers and elastic fibers. Okay? So this adds further support to the wall. What's the thickest layer typically in the artery wall? It's the tunica media. All right? And generally, again, that artery is going to hold its shape much better than a corresponding vein. So usually the arteries, when you see in the tissue section, are going to be round to oval, even when there's no blood in it. You can see here. Okay, here's the vein, and you can see right off it's larger than the artery. It's got a larger lumen, and the shape tends to be rather regular. Veins tend to have thinner walls. They carry blood at lower blood pressure than arteries, often are collapsed or partially collapsed. Now here you can actually see some blood cells in the blood vessel. But again, we got the same three tunics or layers in the vein wall as you do in the arterial wall. So again, the lining again is called what? It's the tunica intima. Okay? Now this one's a little confusing because you've got a lot of red blood cells in it that are sticking to the wall. So those round things are not nuclei, those are red blood cells. And you can see some here in the lumen as well. But if you look over here, you actually see, notice the flattened nuclei here? Those are actually nuclei of the tunica intima. Okay? And then again, you've got your muscular layer here, which is the tunica media. Again, smooth muscle, a little bit of elastic tissue. And then on the outside again, tunica externa, tunica adventitia. And which is the thickest layer here?
What now?
Which is the thickest layer here?
Tunica externa.
Tunica adventitia or tunica externa in the veins. Okay? Which means these are not able to contract as much, not as much vasoconstriction or vasodilation as a corresponding artery, because they have less smooth muscle. Okay? Any questions on this? We're going to differentiate. Okay? And what are these? Those are nerves. Okay? Bundles of nerve fibers. Okay? Any questions? All right, let's take a look at the respiratory. We'll start by looking at a section through the wall of the trachea. Where there's a windpipe. The trachea, of course, carries air between the primary bronchi and the larynx. And again, you should be able to trace the air passage from outside the body to the alveoli and back. Okay, first off, you should be able to identify the epithelium that lines the trachea. What kind of epithelium are we talking about here?
Pseudostratified ciliated.
Pseudostratified ciliated columnar epithelium, right? That's this, from here out. That'd be the lumen, that's where the air passes. Pseudostratified, pseudo means false. Stratified means what? 2 or more cell layers thick. And usually you can tell because you got 2 or more layers of nuclei, or levels. That's what we see here, but it's only 1 cell layer thick, so it's pseudostratified. It appears to be more than one because all the cells aren't the same length. They all sit in the basement membrane, they don't all go as far. That's why you got, appear to be a couple layers of nuclei. But you can see the fact that you got these oval nuclei here, they are in fact columnar. So pseudostratified, ciliated columnar epithelium. Ciliated because the free surface here gets kind of fuzzy. Those are the cilia. What do cilia do? They move the cells?
They filter the air.
Well, they aid in filtration. What are they doing? They're moving the debris-laden mucus okay, across the surface, up to the throat, up to the pharynx. Where it can be spit out or swallowed. So it's helping to filter the air. Where does the mucus come from?
The mucus cells. Goblet cells.
Goblet cells are one, and the goblet cells, remember, are unicellular. It's a single kind of flash-shaped cell. See it right here? That's a mucus secreting cell, and it's embedded in the epithelium, but it's only one cell here, so it's a unicellular gland. There's another source. Where else does the mucus come from?
The mucus cells.
Called what? Mucus cells not accepted.
Okay.
These guys, what are these?
Oh.
Multicellular glands embedded in the connective tissue. What are they called? Seromucous glands. Very good.
Okay.
So seromucous glands, multicellular glands, they sort of almost look like a little donut, started with a bagel, if you will, started with raisins or chocolate chips, whatever.
Zero.
Okay?
Why are they called
Seromucous,
seromucus?
because it's a serous gland. Serous gland.
Serious. Okay.
Serous.
Serious.
Okay, so seromucous glands, multicellular glands in the connective tissue, which this is, and then the unicellular glands in the epithelium, which are goblet cells. So a bunch of goblet cells, and all I want to see is separates mucus. Nothing else, all right? Does not regulate blood pressure. 100 other things I get, all right? There are some things that regulate blood pressure, but it's not
A goblet cell.
goblet cells, all right? Something else you should see in the wall or recognize. This stuff right here, what is this? That is cartilage, and it's hyaline cartilage with one exception. We got hyaline cartilage in the respiratory passageways, i.e. the larynx, okay? We find it in the trachea. We find it in the primary, secondary, and tertiary bronchi. All hyaline cartilage. What's the exception?
Bronchioles.
Bronchioles have no cartilage.
The exception.
What's the exception? Where do you not have hyaline cartilage, but you have cartilage, a different kind of cartilage?
Oh.
Yes, the epiglottis. What kind of cartilage is that? Elastic. Okay, very flexible. What's the epiglottis do? Okay, it covers the glottis when you swallow.
Yes.
So food goes down the right tube, namely the esophagus, instead of down your trachea. Okay, if you're laughing and talking and somebody swallow, you're doing this coughing spasm, that's because something went down into the larynx and trachea, you're trying to expel it. If you don't, you block the airway, you can suffocate. Okay? If you're at the restaurant, we're doing like this, okay? You probably have that chunk of steak that got caught in the larynx or the trachea, and it's blocked the airway. Like I say, then it's time for the Heimlich. Right?
And you have to get permission for that.
Well, not if you're choking to death.
You do.
Not if you're choking to death.
They say you're supposed to, but they can sue
Theoretically,
you.
yeah, but if they can't talk, what are they going to do? Person next to
Shake
them.
your head.
Yeah, person next to them. Okay? Okay, something else you should recognize? This stuff out here. What is this? What is it? Smooth muscle. Now this thing's kind of wrapped around itself, so it's a little confusing. But this would be the trachealis muscle. The trachealis muscle lies between the open ends of those pieces of cartilage. What's the shape of the cartilage in the trachea?
C.
It's like a C, a letter C. And between the open ends of the C, that's where you have the trachealis muscle. What's the function of trachealis muscle? What does it do when it contracts?
Moves out. You swallow?
Sir, constrict the trachea. Why do you want to constrict the trachea? It's like a blood vessel. When you constrict the blood vessel, what does it do to the pressure of the blood in that blood vessel? It increases. If you restrict that vessel, what happens to the air pressure? It's going to go up. And the point is, when you cough, why are you coughing? Other than to attract some attention, usually to expel something. So the more forceful discharge of air, you're more likely to discharge more air.
So from there, where is the C-shaped cartilage?
You're not going to see it here.
No? Okay.
That's part of it. Okay? You just got a thin section. And you can see it on the models. You see it very nicely on the models. Okay? Any other questions on this? Okay? Now the other slides will be on the lungs. You should be able to recognize respiratory passages, passageways, and also blood vessels in the lungs. things, again, you don't need to worry about the pathology, tuberculosis and emphysema and so on.
No?
No, you do not.
Okay.
Okay, what I want you to do is recognize the normal lung.
All right.
And this is normal lung. Now, mostly what you're going to see are a bunch of alveoli, inclusive alveoli called alveolar sacs, and some of these that have passageways, okay, like you're seeing here, for example, the alveolar ducts. In all cases, what you have are a lot of alveoli. This is where gas exchange occurs between the blood and these tiny little air sacs, okay? We're in the respiratory zone here. And remember, you got a conducting zone and you got a respiratory zone. The conducting zone ends with what? The terminal bronchiole. And what does the conducting zone do?
Moves the air to the respiratory zone.
Okay, it conducts air to and from the respiratory zone. In the process, what also is it doing to the air?
Warming it, humidifying it, filtering it.
Right. It warms the air, it humidifies or moistens the air, and it filters the air. Okay? If you're a smoker, you don't filter as well because you kill the ciliary activity. That's why when you get up, a smoker, before he lights or she lights that first cigarette, you're coughing because you're going to develop chronic bronchitis to clear a lot of the debris that collected in the lungs overnight. Okay? And eventually probably emphysema as well. If you're a smoker. If you're really unlucky, you don't have that. Okay, now when you're looking at this, you have a respiratory passageway, which this is, on the left, okay? First thing you should do is determine if there's any cartilage in the wall.
Yes.
If there's cartilage in the wall, what kind of respiratory passageway is it?
Tertiary.
It is a tertiary bronchus. Does not matter the size, it does not matter the shape, but remember tertiary bronchi branch and branch and branch into smaller and smaller tertiary bronchi before they get off the bronchioles.
Okay.
So again, regardless of the size or shape, in these slides, you're not going to see trachea, obviously, unless your lungs get shoved up in your throat. Okay? You're not going to have primary bronchi, you're not going to have secondary bronchi, only tertiary. If there's cartilage in the wall, it is a tertiary bronchus. And obviously, this is, as you can see, packs of cartilage here. Now with the smaller one, you're going to have less and less cartilage, but you're still going to still see cartilage. Okay? So that's cartilage, that's cartilage.
And that big one down there is cartilage as well?
Which one?
On the bottom right?
Right here?
Yeah.
No, that's a blood vessel. There's no
Oh,
cartilage
okay.
in that wall. Okay? There's more cartilage. There's more cartilage up there. So this is obviously a tertiary bronchus. Now one of the larger ones that you see in the slide here. Okay? Go down here. Again, we've got more cartilage.
Cartilage.
Here and here. Next to it here is a blood vessel. You can see a lot of smooth muscle, some connective tissue, but no cartilage. You can also see blood cells. Like in here. What would this be, a vein or an artery?
Vein.
It is a vein. It's irregular in shape. Okay, relatively thin wall, large vein. Okay, we got a couple more respiratory passageways here. All right. Now, you first look at the respiratory passageway. Does it have cartilage? Cartilage, tertiary bronchus. No cartilage, then you got several choices. It's a bronchiole, it's a terminal bronchiole, or it's a respiratory bronchiole. Okay? None has any cartilage in the wall. So your next question is, does it have any alveoli coming off the wall? If it does, it's a respiratory bronchiole. What's this?
That's a respiratory.
That's a respiratory because you got an alveolus right here, another one here. So if you see these like little bubbles coming off, which are simple squamous, okay? That's a respiratory bronchiole. Beginning of the respiratory zone, okay? If it has no alveoli, no cartilage, then it's either a bronchiole or terminal bronchiole. But if it connects to a respiratory bronchiole, it's obviously a terminal bronchiole, which this one is. So we can say this is tertiary bronchus, cartilage in the wall. This one, no cartilage, no alveoli, wall is intact. So this is a terminal bronchiole. We know for sure because it's connecting with the respiratory bronchiole. End of conduction zone, beginning of respiratory zone. All these things out here are alveoli. And again, when you see the canals made up of alveoli, those would be alveolar ducts.
Did you show us a normal bronchiole?
Show you what?
Bronchiole?
Well, a bronchiole, you can find one here.
Which that would be?
Yeah, right here, you could have a bronchiole.
Okay.
To make life easier for you, what I'll probably do is, so there's no confusion, if I point to a terminal bronchiole, it'll be something like this, where you got a respiratory bronchiole right next to it, and connecting to it, like we see here. Okay?
Okay.
How about this thing right here? What's this?
Respiratory.
Respiratory bronchiole, pretty obvious. Here's the wall, looks like it's disrupted. You got simple squamous, one obviously right there. Respiratory bronchiole. You're going to have a lot of respiratory bronchioles. These would be alveolar ducts, like we see here. They're all alveoli in the wall, so all simple squamous. There's another alveolar duct there. Okay. If you look around, there's the bronchiole again. Okay. This one, the tissue's kind of folded, so it looks like the blood vessel here is kind of into the respiratory passageway. What is this one?
That's a bronchiole.
Respiratory. As you can see, the simple squamous right here. Okay. It looks like the wall again is disrupted. So you're going to much thinner epithelium here, simple squamous, so that's a respiratory. What else is a respiratory bronchiole? Let's look at another slide for the lung, section for the lung. Again. What's this? Again, very obvious. This one's cutting cross sections. Those usually tend to be round. If they're cut diagonally or oblique, it's going to be more oval. And if they're cut longitudinal, even longer. Okay. But again, it looks like the wall is partially disrupted here. These bubbles coming off, simple squamous, respiratory bronchiole. Okay. This, by the way, is another blood vessel. Okay.
What did you call that T-shaped passageway right there again?
This thing right here?
Respiratory.
Or what would you call it? What should you
Respiratory.
call it? Let me put it that way. What is this?
Respiratory.
It's also, this one happens to be cut in a longitudinal section, so it's longer, but here's the dead giveaway. Right here, you got an alveolus, you got another one over here. Okay? How about this? What would this be?
Alveolar duct.
Alveolar duct, very obvious, okay, and also one here. Remember, these are three-dimensional, so this one kind of dives out of the plantar section. This one's more in the plantar section. That's what you see. The organ end then, of course, would be alveolar sacs at the end of the alveolar ducts. Okay? So, okay. How about this thing right here? What is it?
That's tertiary.
How do we know?
Cartilage.
Cartilage again, okay? So again, another tertiary bronchus. So cartilage is the wall, tertiary bronchus, regardless of size or shape. No cartilage, then it's either a bronchiole, terminal bronchiole, or respiratory bronchiole. It's got alveoli, one or more alveoli, it's a respiratory bronchiole.
And a terminal leads to a respiratory.
Yes, it does.
Okay.
Like I say, if I'm a nice guy, okay, I'll probably put the two within each other. And if I take the one that doesn't have the alveoli coming off, terminal bronchiole.
Are you a nice guy?
Sometimes. Okay. Okay. Okay, any other questions on this? Well, hopefully it's not as bad as it looks. You can recognize it. So make sure you look at these slides. Okay, there's another model here that you may or may not have gone over. And I'm going to go over it now. And this is what I call the marshmallow model. Somebody have it? This is actually the distal end of the respiratory tract that we have right here. Okay, I'm going to go to the middle so nobody can see it. Okay, first question is, what is this respiratory passageway?
Tertiary.
The trachea?
Tertiary.
Tertiary bronchus. Why is it not the trachea, the nice primary bronchi?
Because it has cartilage in it.
Have the cartilage C-shaped.
That's right, it's not C-shaped pieces. They're attached to the cartilage. That's what this blue stuff is. The first time you say, oh, it's a trachea with a bronchi. No, this is the terminal end, the distal end. What you're looking at is just at the end, and you're looking mostly at respiratory zone here. All right, so this is a tertiary bronchus, and all of these are too. Remember, the tertiary bronchi branch into smaller and smaller. There's something order of like 23 orders of branching, so it's very extensive. So tertiary bronchus doesn't go right into bronchial, it goes into smaller tertiary, which go into smaller and smaller, and eventually a bronchial. So any of these passageways that have the cartilage in them, regardless of size, it's a tertiary bronchus. So if you look around here, you got to look, all right? This one's got cartilage, this one's got cartilage, this one does not. So this is a bronchiole. Now what comes off the bronchiole? A terminal bronchiole. It's this one right here. What is it? The number 5? 2. 2? Okay, that would be a terminal bronchiole. And then right off, what does it give rise to? The respiratory bronchioles, which are these things. Not the red and the blue, but the white. And how do we know it's respiratory? Because you've got the alveoli coming right off the wall. Turn over here, and you can see as well. Okay? At the end then, what look like fingers coming off the hands, these would be the alveolar ducts, and they end blindly then into alveolar sacs, which you see right here. This one's been cut open. And these little individual chambers here would be the alveoli. Okay? And you can see too, the alveoli have an extensive capillary network around them. That's what's the red. Those are pulmonary or alveolar capillaries, and that's where gas exchange occurs. Okay? The black are supporting connective tissue. Don't worry about it. What are the blue vessels? Pulmonary arteries. Remember, it's reversed. And the red? Pulmonary veins. If we look here, look on this side here, you can see the pulmonary capillaries or alveolar capillaries. On one side, they're fed by the blue vessel, which would be a pulmonary arteriole, and they're drained on the other side by a red vessel, which would be a pulmonary venule. Okay, they're collected by the pulmonary veins, and eventually the larger and larger, then they go back where?
To the heart.
What part of the heart?
Right atrium.
Left atrium.
Left atrium.
We're going out of the, getting oxygen.
Left atrium receives blood only from what blood vessels?
Pulmonary
Pulmonary
veins.
veins and nothing else. All right, so if you're tracing blood through the heart, and I give you a vein on the left side of the heart, do not, I repeat, do not take it in the left side of the heart first. It's got to first go to the right side, out to the lungs, back to the left side, and then out. Regardless of where it's coming from, right or left, doesn't matter. Right side of the heart, remember, collects deoxygenated blood returning from the body. Left side collects blood oxygenated returning from the lungs. Okay? Any other questions on this? Make sure you take a look at this. You will probably see it again very soon. Okay? Looks like a bunch of miniature marshmallows here. Are you having your hot chocolate or whatever? Between. In the heart. What do they connect? Don't say the atrium and ventricles. They do not connect the atrium and ventricles. What do they connect? Capillary muscles and what else? Bicuspid, the bicuspid and tricuspid valves. Okay. Where are the pectinate muscles?
In the atrium wall, right atrium.
They're actually both, but they're more prominent in the right atrial wall. Look like teeth of a comb. How about the tuberculi carni? Where are they? They're in the walls of ventricles. Okay. What are the first muscles in the ventricles to contract?
Papillary.
That's right. And then the contraction sequence is from base to apex or apex to base?
Apex to base.
Apex to base. So apex, remember, that's the pointed inferior part. So it's pushing it up. Okay?
Where were the pectinate muscles? I didn't hear that.
They're in the walls of the atrium, especially prominent on the right. They're actually in both. Okay, you can see them in the models very nicely. Okay. What's this white thing here? It runs between the aorta and the
Ligamentum seps.
ligamentum arteriosum. It's the remnant of what in the fetus? Ductus arteriosus. So it shunts blood directly from the pulmonary trunk into the aorta, bypassing the lungs. You've also got something else. This little thing right here, this white. What's that represent? Fossa ovalis, and that's the remnant of what in the fetus? The foramen ovale. Okay. Remember foramen? That's an opening. And I'm sure you studied ad nauseum foramen in the skull. Okay. And there was actually a foramen ovale in the skull too. Remember? Now, by the way, the transverse facial artery. In your book, it's called the maxillary artery. That's why you don't see it in your book. Okay? What's the one that runs over the jaw?
Facial
That's the
muscle.
facial artery. Okay? Okay, there's some calculations you should be able to do. Make sure you can calculate heart rate from an EKG. How do we do that?
Count them.
Count the R.
Count the number of R waves in a 6-second interval multiplied by 10. That gives you contractions per 60 seconds or per minute. Don't count that first R wave. That's the beginning of the contraction. You count the second one. That's the first complete contraction. And that last one, you're probably going to have to estimate. It's going to be a fraction. So it's between 6 and 7. Don't say 60 beats a minute or 70 beats a minute. Say 65, 66, whatever. Okay? I expect to see that. I may give you a heartbeat either way, okay? But I'm not going to give you 10 or 5, okay? Now, if it's 65 and you say 60, it's wrong. If you say 70 and 65, it's wrong, all right? So count. How to estimate that last one, very likely. Okay? You should also be able to recognize the deflection waves and know what they represent. What's the P wave represent? Atrial depolarization. Do not say atrial contraction. You don't see that on the graph. You only see electrical activity. What's the QRS complex? Ventricular depolarization. Again, that's when the ventricles relax, but that's not what you see. You see the electrical activity associated with depolarization of the ventricles. What's the T wave? Repolarization of ventricles. Okay, make sure you specify ventricle or atrial. Which wave is the whitest?
T wave.
Why?
Because it takes longer to
If
repolarize.
it's repolarization, that takes longer than depolarization. Remember horizontal axis on the graph? It's time. It's seconds. Okay? Also, you should be able to calculate breathing rate from those respiration things you did. No? In a band around the middle. Okay? What do we do there?
Count the humps and times 2.
Count the number of respirations in that 30-second interval and multiply by 2. You're not going to use a calculator for that. If you can't multiply by 2, I'm sorry, you're in trouble. Go back to elementary school. You don't even count it if you have, right?
Right.
Also, you should be able to calculate pulse pressure. How do we do that? The difference between the systolic pressure and the diastolic pressure. You should also be able to calculate mean arterial pressure. How do we do that? Okay, diastolic pressure added, not multiplied or subtracted, to the pulse pressure over 3. Okay? Make sure it's diastolic, not systolic. That's going to throw your calculation off. That's the working pressure, basically, in the artery.
And when we put our answer, do we do that when the NMH?
Yes, I want metric units. So when you express pressure, it's going to be what? mmHg, millimeters of mercury. Well, for anything with pressure. So blood pressure, or pulse pressure, or mean arterial pressure. Yes, millimeters of mercury. Okay? That's how we measure pressure. Metric units. Again, you should be able to trace pathway of air through the conduction zone, also through the respiratory zone, either direction. So I could give you a passageway and say, okay, inhale air would pass next into what? Or I could say exhale air would pass from this into what? Okay? So make sure you can do it either way, forward or backwards. All right? As I said, I'm big on trace questions, so you're going to see this in all the organ systems. And of course, be able to trace in these blood vessels, all right? And through the heart. Sooner or later, you're going to see that as well. Also, know the respiratory volumes and capacities. You can expect to see questions on that. And know the formulas. I'm not going to give you those. If you go in your textbook to page 825, there's a nice little diagram there that we went over last time. That tells you. Don't memorize numbers, all right? You don't have to do that. That varies from person to person. You can look that up in tables. But know, when I say vital capacity, how you could calculate vital capacity. Vital capacity is equal to what?
TB plus
Tidal volume plus.
Tidal volume plus expiratory reserve volume plus inspiratory reserve volume. IRV is equal to what? And you did this in lab.
Vital
Don't be surprised to see that on
capacity minus the sum of.
Okay, it's vital capacity minus the sum of the tidal volume and expiratory reserve volume.
ERV, yes.
Yeah, expiratory reserve volume. And you did that. Okay, you should know what all these volumes are. Anything on this sheet is fair game. Now, the lab manual, the Shaw lab manual, notice there are a couple things we didn't do. I'm not going to hold you responsible for that. We'll talk about those in lecture later, but not for the lab exam. We don't do it. But anything on the sheet, you are responsible for. Okay? And you should know what the muscles of inspiration are, and those of expiration. What are the inspiratory muscles?
Internal
Diaphragm
cost.
and external muscles. They increase the volume of the thoracic cavity. In doing so, increase the volume of the lungs and decrease the air pressure. So you inhale. So when these muscles contract, with normal restful breathing, contraction of the inspiratory muscles allow for inhalation, relaxation of those same muscles, exhalation. Forceful breathing, then the expiratory muscles come into play. What are they?
Internal costal, internal oblique.
Okay, internal costal muscles, all right, intercostal muscles. They pull the ribcage down and in, and what else? The muscles of the abdominal wall, which are external oblique, internal oblique, and transverse abdominis. How do they work? They're pushing against the abdominal pelvic organ that shoves the diaphragm up and helps to decrease the volume of the thoracic cavity. Same time, the intercostal muscles, the internal intercostal, pull the ribcage down and in. That puts pressure on the lungs, increase the pressure, and it goes out. This way you get it out faster and breathe in faster. So with forceful breathing, you exhale with the aid of these expiratory muscles. Restful breathing is just relaxation of these expiratory muscles. Okay? Any questions on this?
What's the formula for the forced expiratory volume, the FEV one, for a second?
Okay, on that one, I'd have to give you vital capacity, and I'd tell you what percentage of the vital capacity the FEV sub 1 is. And then you simply multiply that percentage by the volume of the vital capacity, that gives you a volume of the FEV, like we did in the morning. Okay? And that's just a pulmonary function. FEV is what? How much air you can exhale in 1 second's time. And for a healthy adult, if you're not a smoker or an asthmatic, you could probably do about 75 to 85% of your vital capacity. Some people are in really good shape, they can blow out the whole vital capacity. Okay? If you're a smoker, if you're asthmatic, or you're old and feeble, okay, you're not going to do as well. But young and healthy and normal like yourself, if you're a smoker or asthmatic, you maybe could do it. Okay? Yes?
Okay, you said the expiratory muscles push against the abdomen organ and what else?
They shove against the abdominal pelvic organs, which in turn shove up against the diaphragm and help to force that diaphragm up more forcefully as it's relaxing. So it's forced exhalation. Because when you're exhaling vigorously, like with exercise or excitement or fear or something, you're going to be breathing more forcefully. That's when they come into play. Because you want to get that air in and out faster. So that's when they are involved with expiration. Okay? Okay, now obviously know the parts of the conduction system and the sequence of contraction, know what bradycardia, tachycardia, fibrillation, and defibrillation as well. Okay? And obviously you should know the blood vessels on the heart itself, the coronary, left and right coronary arteries, the two major branches off of each. What are the two major branches off the left coronary artery? What's the one that runs down the front in the anterior ventricular septum? Anterior ventricular artery, the one that runs down the side of the left ventricle.
Circumflex.
Circumflex artery. There's the two major branches off the left coronary. What's the one on the right coronary? You mentioned two. Marginal, okay, and the
Posterior.
Okay. We talk about two major cardiac veins. What are they? What's the one in front?
Great cardiac vein.
And the one behind here?
Medium.
That'd be the
Medium.
middle cardiac vein. Okay, that's only two of a number of them. Where do they drain? Into what?
Coronary sinus.
The coronary sinus carries the blood into what?
Right atrium.
Right atrium. You can see a little blue spot in the interatrial septum. That shows the entry of the coronary sinus. Okay. Oh, also know the pulsar pressure points, which are listed here on page 5 of your handout. Okay?
Can you go over fibrillars so they need fibrillation again?
Well, fibrillation is where the heart basically loses coordination between the contraction of the atrium and the ventricles, and you don't get effective pumping action. Defibrillation is where you shock the heart, you give it a good electric charge, that sort of stops it momentarily, resets it, and you go back to the regular sinus rhythm. As you walk around campus, you see these kind of bright yellow-green, okay, chartreuse, little plastic containers, IEDs, or AEDs, automatic electronic defibrillators. Okay, you open it up, and it walks you through. Tells you what to do. And one of the first things it says is, call 911. All right? And then you follow the directions, and then one of the last things it does when your paddles are charged, you got them on the body, and it says, clear, or you'll defibrillate yourself, because it'll go right through your body as well. And then the body will jump, and you've seen this in many medical shows and movies. Okay, they got the guy in the ambulance, they rush to the hospital, they zap him, the body jumps. Why? Even if he's dead, it's going to jump. Why?
Electrical current.
You're stimulating skeletal muscle as well. Okay, that's when you do your EKG. You're moving around, laughing and talking, what is EKG? It's all over the place, okay? Or if you change your breathing, it's going to be the same thing. Because you got skeletal muscle activity as well. Any other questions?
Will we have another word bank?
Yes, we will.
What do we need to know on this model?
And again, you must show your work, all right? You put the answer down, even if it's the right answer and there's no work with it, it'll say work, question mark, line through it, all right? It's usually a copy from a calculator. I want you to show me how you did it. And if you get the wrong answer, you get partial credit if you set it up correctly. But sometimes you just make it really clear. And I see that frequently. You set up beautifully, and for some reason, yeah, you put the decimal in the wrong place, or you get some bizarre answer. It doesn't make any sense. Okay? At least you knew how to do it. All right? Yes. What's your question?
What do we need to know off of that model?
On this model, at this point, really not very much. You got a little bit of the pancreas, but you'll see a better example showing the vessels on the pancreas and the spleen and so on the that muscle. I mean that muscle. Okay? Yeah. You got a little bit of pancreas here, a little bit of the which you're not doing yet. I would use this one. You'll see this one soon though when we get to that vessel.
Be patient.
Preview of coming attractions.
Ones ago, I know there's a vertebrae, but
Oh yes. Where's that mark?
Right
This
there.
one. I suggest you take a look at this one. Now on this one, it's very nice. It shows the division of this artery, which is what?
Carotid.
Which
Oh.
one? This
The
one right here.
left.
Left what?
Common
Left
carotid.
common carotid artery. Okay, and it divides into this one,
External,
left external carotid artery, and this one,
left internal
internal, which
carotid.
comes in here as a major blood supply to the brain. Okay? How about the runs that run through the transverse foramina of the cervical vertebra? Vertebral arteries, left and right. They come up here, and they kind of come together, okay? And they form this one, or they come into this artery, which is the basilar. So the two major blood supply to the brain, two major groups of arteries, are the internal carotid arteries, left and right, and the vertebral arteries, left and right. Okay, so you got sort of a backup if there's a blockage. All right? So that's a good one to see that. Most of the rest of the stuff here, I think it's better on the model of the face. All right? I'm not trying to trick you, but I want you to know these. All right? So I'll give you examples where you got the best, where you can see it the best. All right?
Can you go over the picture one again?
Over this one.
Yeah.
So in this one, okay, you can see the jugular veins. Internal jugular is this one, and the external jugular is here. Okay? You also see, and again, all the veins are in blue here, all the arteries in red. You can also see this one right up here, this artery, and you can maybe see it better in the other one, which is a little lighter.
This one?
Yeah, I can see a little bit better. Okay. So again, this one again, this would be the external jugular vein, and the one here would be the internal jugular vein, the blue. Okay? This red one that comes up here and crosses the temporal region of the skull, what do we call this?
That's the temporal.
Superficial temporal artery, okay? It gives off a branch that runs across the cheek here, coming right across here. What do we call this one?
Transverse facial.
Transverse facial, or your book calls it a maxillary artery. You can use either term, all right? How about the one that runs over the jaw here? What do we call that? The red one. That's the facial artery. Okay, the anterior facial vein is this one right here, the blue one, next to it. Okay, back here, the blue vessel, the occipital region,
Occipital.
occipital vein, and the red one be occipital artery. Okay, did I leave anything out?
Internal and external.
Okay. And over on the other side, what are these things?
Concha. Superior, middle, and inferior.
Those are the conchae, okay? Superior, middle, and inferior conchae, and they form channels here, here, and here, which are the meatuses. Superior, middle, and inferior meatus, okay? You should also know the sinuses, and you can see a couple of them here. Whoops.
Good catch.
What's this sinus right here?
Frontal.
That's frontal. It's in the frontal bone, okay? This one back here,
Spin.
that's the sphenoid. That's about all you can see on this one. You get the flap. There's the flap. Okay, on this one, this one had one of these things labeled, and every one was wrong on the label. So be careful on these label things. Maybe the guy that did it, okay, he wasn't as familiar as you were with these. So don't go by that, all right? All right. And also, too, on these word banks, sometimes, you know, they're old, they've been marked. Just because somebody marked it doesn't mean that was an answer. So be careful. All right. This, again, is a sphenoid sinus. This, again, is a frontal sinus. And then here in the frontal or coronal section, what are these sinuses? Those are maxillary. Okay, the maxillary bones. And right in here, these are the ethmoid. Okay, because this is your nasal cavity. And you can see just a little bit of frontal, sort of look like eyebrows here. Okay. These, of course, are the orbital cavities where your eyeball would be. And then you can also see the conchae here, okay? These would be the inferior nasal conchae. These would be the middle, and up here are the ethmoid bone, superior nasal conchae, which you can actually see better over here, okay? So make sure you can identify those as well, all right? And, of course, the tonsils, pharyngeal tonsil, the lingual tonsil, and the palatine. What's this little flappetition hangs down?
Soft palate.
This thing right here?
Oh, no, that's
The
Uvula. What's the function of the uvula? And don't say snoring.
And nasopharynx when you
It flips up when you swallow to keep food from going up your nose. All right? And of course, this opening here, that'd be the glottis. And here you can see the epiglottis, or the sporting cartilage. Okay? And make sure on the larynx that you can identify what cartilage is. Thank you. Okay. We have 9 cartilages that support the larynx. All but one are hyaline cartilage. What's the exception again?
Epiglottis.
Okay, the epiglottis. All right, so the 3 large cartilages are single. The largest one is this one right here. What cartilage is this?
Hyoid.
That's the thyroid cartilage. What's the bump on the thyroid cartilage called? But the technical name, which I prefer? Laryngeal prominence. We all have one. It's more prominent in males because they have larger cartilages. Okay? And when you swallow, if you put your finger on that, it moves. Which way?
Up.
Up. Because what happens is muscles pull the larynx up, and it puts the epiglottis, the opening, or excuse me, the flap in contact with the opening, and it covers the opening. So when you swallow, food goes down the esophagus to the stomach and not down into the larynx and trachea to block the airway. Okay, so we've got the epiglottal cartilage. You see here, that's one single cartilage. We've got the thyroid cartilage, which is this one. And then the inferiormost cartilage, which is also single, is the cricoid. And that expands posteriorly, as you can see here. It's actually covered with muscle, but it's been stripped away on one side so you can see it. Cricoid cartilage. And then we've got 3 small pairs of cartilage, the largest of which are these, which are kind of the shape of a right triangle. You can see one. Okay, there's actually 2. It's covered by muscle. What are they called? A retinoid. Retinoid cartilages. And then atop that, you can see also little triangular cartilages. What are those called? Paniculate cartilages. And the 2 up here, little bumps covered with soft tissue, are cuneiform cartilages. Okay? When you open this thing up, You can see two folds going across the opening here. The superior folds, what are they called? They're called what? Vestibular folds or false vocal cords because they're not involved in sound production. And the other folds, or inferior, these are vocal folds or true vocal cords. They're elastic fibers. They vibrate when air passes over. That's what allows you to make sound. And the little cavity between? Ventricle, unfortunately. Okay? All right? What do the vestibular folds do? False vocal cords. They're just there. They come together so they can help keep food from going down and also aid in breath holding. They come together. Okay? So what helps to keep stuff from going or blocking the respiratory passageways? Epiglottis would be one. False vocal cords would be another. What's the third one?
Uvula?
Uvula. Right. Okay. They all have a function. What's this white thing?
Hyoid bone.
What's distinctive about the hyoid bone?
It's not connected to any other
The only
bone.
bone does not articulate with any other bones. And what's the forensic pathology behind this? The forensic pathology. Don't CSI? A fractured hyoid usually means what? Death by strangulation. Okay?